Hi, I am Shweta here, and today we have a very special person, Dr. Kamal Kant Lal, who applied my most trusted author model and he got published. So, congratulations, Dr. Kamal, and really very proud of the fact that you've self published your book. Congratulations and welcome.
I thank you from the bottom of my heart, and everything happened just because of you.
I'm really happy to see that, happy to see your book, and it's available in all formats, not just paperback, but you've gone ahead and done a hardcover also. So ebook, paperback, hardcover, awesome job, awesome job. So tell us about you, Dr. Kamal. Who are you? What do you do? As I can see that you're a doctor, so are you still practicing? And yes, let's hear from you.
Yeah. A short introduction. I am a physician, and I have worked with the state government. Then I worked with World Health Organization as a consultant for 10 long years, and I was working for the vaccine preventable disease. And then just because my children missed me, I was away on a very travel intensive job. So I had to come back to my hometown, and then I joined corporate hospitals. And then lately I have taken a retirement. I mean, I'm about to retire in next few months, but then I have already taken a retirement, and I am a consultant in a corporate hospital, working as a consultant.
Okay.
And I am a diabetologist and a wellness coach.
Wow. It's awesome, to hear that you work with WHO also, and as a consultant, you're working with, corporate hospitals. That's amazing. So, people, let me show you the book. Okay, here is Dr. Kamal's book. It's called Health Ownership Manual. I hope that you can see it. And here it is. As you can see now in India, it's a Kindle edition, and it will be available in paperback very, very soon. So go ahead, grab a copy. The link would be here. So tell us about this book, Dr. Kamal. What is this book about, and why did you think of writing this book?
Yeah, it all started. Am I audible?
Yes.
Yeah. It all started with the corona pandemic. During the pandemic, our whole lifestyle changed. And whatever good things that we followed, we were not able to pursue those things, those good habits. And in this long corona pandemic period, we took to, while working from home, we were not doing enough of physical activity. And then when you have nothing to do, then you have start, liking for foods, and you take more of food, and then what to do and kind of a thing. So, this all, I thought that this is not good for health, because I have been always working for preventive diseases. Even, today I am working for the disease prevention, because prevention is better than cure. And I have been working with WHO, where we were working for disease prevention. So I thought that there should be a book which can guide people to manage their lifestyle in whatever circumstance that they are in. And since topic, so I thought that I should write a prescription. So this book is not a book, but a prescription to a healthy living.
Wow.
And these prescriptions, it is so simple. I've written in such a simple language that even a Hindi reader can go through it and follow it. And at the same time, all the lifestyle modifications that you need, they are, I mean, such doable in a doable form. I mean, it's a self-help book. You can do it yourself, kind of a thing, DIY. So I thought that this is a play. There is a place. This book has a place in every house. Every house needs it. But at the same time, since you mentored and you thought I you, whenever you write, it should you should have a mindset of addressing to a focused group of people.
Yeah.
So I thought that just because of the poor lifestyle, many people die very young, and they die of lifestyle diseases, which are not only preventable, but they can be delayed, and even you can live with those lifestyle diseases if you are done. So I thought if a bread earner of a family dies, then the whole family, I mean, who are dependent on his financial support, they are ruined.
Yeah.
So my focus group is the bread earners. They should be more thinking, talking about, I mean, concerned about their maintaining their health, taking ownership of their health, so that they live longer and fulfill their responsibility.
That's a great thought that you're focused only on the bread earners of the family and helping them prevent diseases and own their health. As the title also says, it's a health ownership manual. And I really liked what you said, that it's your prescription. Okay. And you've said, you've given your prescription very simply in a simple language that anyone can understand it easily.
Right.
So how did you got this idea that I have to write this? Did you see some people who were getting diseases because of this corona period, sitting and eating a lot or watching, just having that lethargic life? Did you see such people, and that is why you decided that, okay, let me write a book, they need help? Or
Yeah, thank you. Thank you. I forgot actually thank you for asking me this question. Actually, since I was more concerned with the public health aspect of that, so the MD of my company, Mr. R. N. Murthy, he is the MD, managing director. During the Corona period, he wanted me to uh, develop a program for the employees so that they maintain their immunity and at the same time they remain healthy. And because the corona was affecting more those people more who were having some comorbidities like blood pressure, sugar, and other things.
right.
So I developed a program called Wellness at Workplace for my company employees.
Wow. Okay.
So that Wellness at Workplace program, actually, this program in other countries, this is a very complex program. But then, because of my experience in this field for over a decade, I developed an Indian version of the Wellness at Workplace program that was very simple to follow. And then the next thing that my MD wanted me to do is to have a small interaction with the family members where I would tell them how to maintain good health. So I did a number of, I mean, tens of, so maybe 15 to 20 such sessions with the employees and their families and with the other stakeholders. And then I thought that it is very difficult to just go and deliver a lecture, because in 1 hour, half an hour, it was very impossible to tell them everything about lifestyle management. So
Right.
there I took the idea to have a book so that I can refer the book to somebody who wants to change or modify their lifestyle.
That's such a great thing that has come out from this, that you cannot be everywhere, plus you cannot cover a lot of things in that 30 minutes. So why not write a book so that your book can reach so many people, help so many people, while you don't have to worry that whether you've covered all those points, and they can refer it back again and again to that book. Amazing. That's one of the reasons why someone should write a book, like someone like you who should write a book. So amazing. So people, go ahead, grab a copy of this
Thank
book.
you.
Okay. So how many days did you take to write this book, since you had already developed a program, and then you had a lot of discussions? So was it easy to write this book then?
Actually, I was planning to, I joined your course quite long back, but then I was trying to write some fiction. But what happened in the month of January, I'm the COVID coordinator of my hospital. But unfortunately, I was infected with COVID.
Okay.
I became infected, and then I was given out of my hectic schedule, my CMS, my Chief Medical Services, Dr. Rekha Singh Ganguly. So she said that I should take rest because I'm COVID positive, so there is no way that I can come to. I was then in my house for 7 days, and I wrote this book in those 7 days.
Wow. Okay. So you turned around that thing for you. You used that as an opportunity, and you converted your knowledge into a book. Okay. That's amazing. And what about the other book? Did you complete it, or no? You didn't.
Yeah, you said that you will be interviewing me on my author journey. So the author journey, basically, I'm a writer from my very childhood.
Okay.
Uh, I wrote my first book I wrote was a pocket book for children when I was only 14 years old. And that was published by some Raju publication kind of thing. I don't have the copy anyway.
Great.
But then the next book that I wrote was on mathematics. Though I'm a doctor, but I was very good in mathematics, and a book in mathematics student when even before I passed my matriculation. Those days we called matriculation because these days it is 10th plus 2. But then there was no publisher for that. Then after when I literally thought that I'm retiring from my active life, then I wrote 2 books, one in Hindi novel and one English novel, fiction book. But since you were not there, I could not sell out. I could not launch it properly. It is just lying on my shelf. And no one read those books. Even my family and friends whom I gifted those books never read them.
Okay.
So that is why I joined your course, where you have mentored me to get published, not only to write books, but get published. And in this journey, though I had some knack for writing, but then I didn't know many technical things that formatting, that all those secrets that you tell in your courses. I'm not going to reveal those secrets here. It's your property. But then it has really, really turned me into a real writer. What is the fun of writing a book and no one reading that book?
Yes.
So I gave all the credit to you.
Amazing. So now a few more things have come out from this discussion, that you are a prolific writer. You've written like 4 books already before you joined my course, and now this is your 5th book, right? Then this health ownership manual, right?
This is the first fiction book, non-fiction book.
Non-fiction book. Okay, and earlier all are fiction. So it's time to put all those books, in front of people and start marketing them. All the 5 books. And okay, so let's see, what is the advice you would give to anyone who's starting out, since you right from your journey from childhood till now, from your own experience as an author, as a writer, what's the top 3 advice or whatever you want to tell to the first time authors they should do?
Yeah. As you can see that I am quite old. Now I am going to retire. And since childhood, I have been writing and I have been interested in literature. And I would suggest that before jumping into writing, writing is basically an art. Maybe you have something to tell it to the people. That is why you think that I should be writing. But then you should know the art. For last almost 60 years, I have not been knowing what is the art of writing. And that art you have to learn. And you have to learn from a good mentor. You need a mentor for writing because you may have thoughts, you may have a very good message to give. You have something which is very valuable to the society and to the people's life. But then to reach the people in right manner so that it changes their life can only happen if you present them in the format where it has got the maximum impact. And for that, you need a mentor and you need real coaching on the technical aspects of writing. And at the same time, I mean, your classes are also centered around how to develop ideas, how to write good dialogues, how to write, how to begin a story, how to end a story. So that is a complete package. That is a complete package. But then for the new of writers, you get mentored, and then your ideas will take a beautiful shape where people would really like your writing, and then you can grow as an author also. Until unless you are not read, you cannot grow as an author.
Great. Thank you for that. Now, one more question, Dr. Kamal, is any incident that you remember, or any funny incident, or any impactful incident that has happened in your author journey so far? Anything that you want to share? Anything in particular that actually changed or was a turning point in your author journey?
Yeah, it happens with every author.
Okay.
It happens with every author. It's not a new thing that I have experienced. You write a book, you put in so much of effort, put so much of emotion into it, and then when you give that book to somebody and he doesn't read it, that is the
It's a heartbreak.
most disheartening thing. And that happens because they think that you are not a writer. So to make people believe that you are a writer, they have to read it. And they will read only when they see the tag of bestseller, or maybe people praising your work. Even my children don't read my book to say, is it a funny thing, or it is a very sad part on my author journey, that my own people whom I gifted my book didn't bother to read. But now they will read. Now I'm confident.
Yes. Okay. So one tip to you also and to everyone who is listening to this is that, Dr. Kamal, everything that is happening to us is a reflection of our own inner self. So probably they have not read because they have not seen that conviction in you, या फिर वो force नहीं आया, okay, आपकी तरफ से, that यार book नहीं पढ़ी, I'm waiting for your review. So you have to follow up with people, even your kids, even with your brother, sister. You have to follow. Did you read that particular chapter? That is one of my favorite chapters. Go read it out. So we take, so actually we are very emotional, and we expect a lot from our family members that ye to padhenge at least, but from my own experience, I'll tell you, same thing happened with me for my first few books. Now I ask them, did you read it? And it has no, now they go ahead and read it and they call me back, okay, I read it. So वो फोर्स आपके तरफ से भी होना चाहिए उतना ही that वो इमोशन उन तक पहुंचना चाहिए that you're expecting them to read, they'll read it.
No, after your course, I am quite prepared. And after this interview, I know whoever, sees this interview, watches this interview, will read mine for sure.
Yes, that's the spirit. So one more thing I want to add, if you're okay. So
Yeah.
when you said that you're retiring, you should now be speaking that you are on a new journey. This is not the end. This is the start of a new journey for you. Okay. So you've served as a doctor. Now it's time to serve as an author as well. And people start their career at 60, even at 70. And it's not just you. I have a lot of people who have started really well at the age of 64, 68, 70. So it's a start now, new start. So I want you to vision for yourself next 10 years, next 15 years, what are you going to do? So it's a new start.
I'll make proud. You will be proud of me.
Yes. So one more question, which is one of my favorite questions. I ask this to everyone. The question is, did you pay anyone to get published? This particular book.
Clear.
Did you pay anyone?
Not a single. No, that is the beauty of your coaching.
Yes. Congratulations once again. And I guess I'm done with all the questions. So thank you so much. And once again, my best wishes to your book, Health Ownership Manual. People, go ahead, grab a copy of this book. Do read and please review, because review matters a lot and it will help a lot of other readers to go ahead and grab this copy when they read your review. So grab a copy, read your review. जो prescription है उसको follow करो from Dr. Kamal. And thank you so much, Dr. Kamal, for taking out time and doing this interview. Thank you so much once again.
Thank you once again. Thank you once again.